Good morning. I'm very glad to be here this morning with you, and it's always been my pleasure to be a part of the GIPC symposia, which has been being conducted for the past 7 or 8 years or so. I have a brief presentation for about 15 minutes or so on this session's objective. The main objective of this symposium is definitely the IP strategy and IP management, but this particular session is on the R&D's contributions, or what kind of strategy the Indian pharma industry should have. So I have a few thoughts on that. You will find it at random. I'm not focusing on any particular key area, but probably I will just share some views, and probably at the end of the session we can discuss them. This is what I think the IP management is all about, probably with respect to the pharma industry. There is what is the first part of management should be creation. So the creation of IP, then comes protection, then exploitation, and then compliance. So probably these 4 or 5 aspects together form the IP management. And if you discuss comprehensively, you may find gaps in all of them or some of them. And that's where I think probably the Indian pharma industry should look at. Ideas to products through effective management of IP is probably that should be the motto of the industry. And if you see the methodology, of course, this is a standard methodology, but I have been following since morning the inventive step part of it. The novelty part probably is not that difficult to prove, but nowadays the examiners are more critical about the inventive step aspect of it. Yes, it is novel. So what? Is there any inventive step in that? So this kind of aspects probably the R&D scientists should be trained and should look at it. It is becoming more and more tougher nowadays. And I think sometimes I say that the process research, the product research is different. The completely novel product, and probably the inventive step or the novelty part may not be that difficult. In the process aspect also, in the pharma industry, we teach people sometimes that it need not be completely novel route at all. Completely, sometimes the route may be, there will be overlapping route, but still you can bring about novelty by talking about process elegance or novel chemistry or operational simplicity. But nowadays we even talk about the low environmental factor. Environmental impact could be less. One might be using a very less toxic agent and producing less amount of waste. These are some of the things which we can probably enlighten or the underline in the patent application, and that is the way to impress an examiner and get some claims out of it. Even high quality, for example, you can talk about impurities and say that a particular level of impurities normally is not lower than 0.5%. It's extremely difficult, and you have a novel method of purifying it. So probably some of these things could be additional things for a process patent. And this is what it is we're talking about now, shifting the product patent to process patent thing. And the entire industry is talking about the genericizing the innovator products. But a stage should come for the Indian pharma industry, we have been discussing in the morning, that from the generic industry to discovery industry, when you shift, the shift in focus of IP also should be commensurate with that. Normally, the senior professionals in this industry call small r, d, big R, small d, big D, small r. What it means is generic is predominantly big D, more of development and less of research. That's what is criticized about. But when do you want to bring about this change of shift in focus from big D to big R? When a lot of research is involved, then the invention methodology or the invention the quantum will be much higher, and that shift is what is it's going to happen. I think these two are not different. although there is a lot of commonality between process research and product research. Product research probably is a kind of a basic research, and where the components of inventive step or components of the improvement, it will not be incremental, it will be radical, substantial improvement. This change has to take place in the industry. Otherwise, Indian industry will be always called as a generic industry. It will not be called a discovery industry at all. So that has to happen. And this we have been discussing for the past 10, 15 years. We have seen very, very senior professionals in the industry like Professor Muchal Ramaya is here. We have been discussing this since probably 15 years or 20 years. But nothing much is happening radically. That's because Indian industry is focusing more on the generic side only, and discovery side, commensurate efforts are not being made in a methodical and focused manner. We are still on the D part only, not on the R part substantially. Maybe some industries are focusing, but not enough. And this is what it is, exactly, the incremental to significant to radical. This change has to take place. You probably are in the, still in the first part only, in the incremental or moderately significant, but not radical. So that is what it is. Now, Section 3D talks about it. We have been discussing in the morning. Section 3D is not for others to follow. It has to, for us also to follow. That means when it is incremental for you and incremental for me as well. Therefore, this incremental to substantial has to take place in a much rapid way than what it is happening in the industry now. Even in so-called discovery thing, you find such things. Non-pharmacophores are taken and improved, or non-analogs are taken and then further improved. And okay, you can show novelty, and we are getting patents. But probably these are the comfort zones. These comfort zones from the generic industry to generic discovery industry, I would call. Analog design is called generic discovery. That means you take another analog and design another analog after it with great amount of inventive step, probably. We are getting patents out of it. But still probably that won't make any great dent in the discovery arena of pharmaceutical research. I think that's what it is we have to come. This is what I think. One rule applies to all. Section 3D is not to oppose somebody's patents. Section 3D should be applicable to us also. If it is incremental for you, it should be incremental for me as well. So that is where I think we have to see that incremental to radical innovation has to take place in the industry. Grassroots innovation, it is substantial. So that has to take place in the industry. And this criticism is not somebody else's, it is criticism at our end. We are criticizing ourselves in the industry. That has to take place. And otherwise, we are now in terms of figures, 15 billion or 20 billion exports and all, are comfortable for the industry in terms of economics, but not in terms of research and development. That has to take place, and that has to take place sooner than later. And then, of course, patent challenges, the domestic industry is quite conversant with that. The Indian domestic model, we know that. We have a pre-grant opposition model. We have a patent revocation tool also, using the Section 3D principles. And even this is becoming tougher. It is not easy anymore to oppose a patent or to revocate a patent. The strong prior art data analysis, interpretation is required, because we've seen that couple of cases which went against the Indian industry shows that the kind of homework which industry is doing is not enough, because when the criticism comes, the review part also becomes tougher. And of course, a parallel model in US, the Para-4 litigation. You can find a parallel. It is either a patent non-infringing approach or patent invalidation approach, which any ANDA filer in US with respect to Para-4 certification takes place. So here also, then R&D has a role to play. It is always better to come with non-infringing options. It could be a non-infringing route or non-infringing polymorph, if it is a polymorph patent, or non-infringing formulation, or non-infringing delivery system. It is far easier to win on Para-4 on a non-infringing option than an invalidity option. As we ourselves, and with our limited knowledge of Para-4 at NATCO, we have seen that non-infringing options are better to convince people than the patent invalidity options. That's what I have put tick there. Non-infringing options are better. patent invalidation options or inherency and anticipation. We have seen that some of the Orange Book patents, the first patent describes a product, and then comes after 5 years a polymorph. Then the question comes, only the laboratory scientist will know, not the examiner. What happens if the example 1 of the first patent is reduced to practice? It must belong to some kind of a polymorph. There is nothing like a product which doesn't belong to any polymorphic class at all. So that kind of an R&D inputs are quite useful when you challenge the US patents by paraphor route, inherency and anticipation. But nothing to beat this non-infringing option. If you have a non-infringing polymorph, non-infringing product, non-infringing delivery system, it is much easier to fight this patent battle. Particularly, we can apply for our own patent, and by the time the litigation is going on, if the patent is granted, it is much useful tool. So a lot of R&D laboratory work and data collection is required to employ IP component and then act as per a particular plan and strategy are required in these paraphor litigation cases. And then comes about the compulsory licensing also has been talked about in the morning. Out of the 3-4 licensing options, compulsory licensing, the very word compulsory is a hostile word, right? The moment you say it's compulsory to sit here, you will ask, why should I sit? So it's something like this. Compulsory is not a very friendly word, it's a hostile word. But then, our own company, NATCO, is the first company to get a compulsory licensing for buyer, and of course, it is a matter of affordability, accessibility. I have put these terms, socio-economic and geopolitical. Acceptance rather than compliance. We are not talking about laws and rules here. TRIPS and GATT compliance is there. But I just find that now even in the morning somebody is asking about the compliance thing. Acceptance. Acceptance is different from compliance. So when acceptance is not there and compliance is there, it becomes hostile. That's how the compulsory licensing phenomenon has taken place. So I think, and then after the first one, I think we have seen 4 or 5 years are over, there's no second one is seen. Why? Again, I put a word on the compulsory underlined. Because it is compulsory, because it is hostile, you may not find many examples probably in the years to come. Because I have put here, is CL issuance getting tougher, or are the cases weaker, or inadequate data and preparation? All these things are happening. So the ones which we have seen, two to three things which are turned down, are because of that. Either the preparedness is less, accessibility, affordability, all those things, or the data is inadequate, or the standards themselves have gone up. The bar is raised, and therefore probably we are not getting it. So all these things have to be taken care, and therefore we have to do more homework than what was necessary earlier. The moment you say voluntary, it becomes a win-win type. It is no more hostile, it is a friendly thing. We got that also. No, luckily for NATCO, we are all in all models. Even if you do 6 things belong to 6 different categories. We have an in-licensing model, a win-win situation from Gilead. One product has been licensed to us, it's a hepatitis C drug, and it is a win-win model. They have licensed to us, and there's no great heartburning about it. So maybe many more will come. And negotiated licensing models. So these are the things probably which should be encouraged. Not that I'm against compulsory licensing or anything. These things will be encouraged, and they will not be criticized much. And probably we can think of different offshoots of this. Probably the innovator companies who are licensing to the generic companies in India can think about what more can come out of these collaborations other than voluntary licensings. So synergizing dual strengths, that's what I have coined there. So this synergizing dual strengths and converting this voluntary and negotiated licensing deals into a win-win type of situation, probably that is what we are going to see in the next 5 years or so. So now I think the shifting from generic to discovery model, we find intentionally I put a gap there, substantial cross-functional IP creation. IP creation in generic research is relatively less difficult, I will say. I will not say easy. Whereas in discovery model, at least you can see in a drug discovery, about 7-8 cross-functional teams are required, starting from molecular modeling, synthesis, in vitro, in vivo, pharmacology, and then preclinical, clinical. So many cross-functional teams have to work, and everywhere there is a necessity to bring in IP component, and that is what is required. I think I will finish it in the next 5 minutes or so. And out-licensing model, further studies. I have a feeling that probably if India focuses to finish from 0 to 10, all by itself, it might take more time. So at some point, like proof of concept at in vitro and in vivo, that is the time for out-licensing India to other companies. And that is the model which we want to see and to make it successful. And these are some of the post-patenting things like opportunities for tie-ups and collaborations, tech transfers. These are the where probably India should be going into in the next 5-10 years or so. Nurturing innovation culture, in quality and quantity. I think that's what we need now. And of course, in the end I have put, we think of Edison, 1.5 centuries back, he was doing all this. What we are talking now was done by Edison himself. Now, these are phrases coined against him, in line with his thinking. Meaningful new patent every 2 weeks. Every 2 weeks he was generating a meaningful commercializable patent. So somebody, like Professor Ramarao was questioning, with 5,000 scientists in CSR laboratories, what we are doing, how much we should be coining. If that is the model, one person could do it 1.5 centuries back, and all of us together probably are not still incremental stage, we have not reached a radical stage. And I think this is what now the little caustic thing, this is a criticism against ourselves. We are not criticizing anybody. We are good in digging pits, not wells. If somebody wants a well of 700 feet, we think of a mathematical model of 70 into 10, and each one of us dig 70 pits of 10 feet each. And mathematically we say 70 into 10 is 700. Probably it is not true because you end up only in pits, not wells. I think this is what we have to see, that synergizing, because this is a criticism against us only. Therefore, there is no causticity about it. Somebody has questioned us at NATCO. With all this pool of 400 scientists, but still your output probably could be better. I say, yes, it could be better. It is because of this only. I call this pit and well syndrome. So unless the Indian pharma industry comes out of this pit and well syndrome, it is very difficult to come out of this generic model and come to your discovery model. I think that's what it is. Scientifically, we can do a lot more if we manage our talents and focus better. Thank you so much.